Hello. Hi, everyone. I have Becca with me today, which I am really excited about because she is a top expert in all things exercise during pregnancy. And so I have got some great questions for her today. And the reason I wanted to have a chat to Becca about this is because I have a lot of women coming to me who talk about exercise during pregnancy, and they talk about the fact that, before pregnancy, they did exercise, they did regular exercise, maybe. Some of them do quite a bit of exercise before pregnancy. Some of them may not have done so much actually, but they get to pregnancy and go, oh, what do I do now? And they're a bit lost, and they're a bit like everyone's telling them different things as well. So yeah, I'm really happy we've got Becca here with us today because she's going to put us right, I hope, and get us on the right track. So, welcome, Becca. Thank you so much for doing this today. Do you want to do a little intro in terms of what you do, why you do it, that kind of thing?
Yeah, so my name's Becca and I've been a personal trainer for over 10 years. And recently I started specializing in women and strength training. And mainly because, well, the main reason actually is because I think for me it's really important when you get to 80s, 90s. I used to do a lot of stuff in care homes like dance classes and stuff. And I saw the impact of exercise and not exercising. And I think that having your strength training early on really sets you up positively for later in life. But I also have had clients go through pregnancy and also menopause, and just how important strength training is through those times as well. So
Yeah,
I'm really glad to come here and be as much help as I can to you and your audience.
fabulous. Oh, that's really interesting. Starting out in care homes and looking at what happens with them. Yeah, that's fascinating, actually. There's lots of similarities in, yeah, so many parts of our lives, isn't there? I want to kind of start off with benefits side of things for during pregnancy and really kind of what are the benefits for exercising during pregnancy? Because some of us, when we're pregnant, just want to sit and do nothing. And kind of in the
Hmm.
back of our heads, we're going like, oh, I should be doing something. What should I be
Yeah.
doing? But also to get us up out of off of the couch, what should we be doing and why? So the why, I suppose, of what the benefits really. That's what I'm getting at.
Yeah, so the first to the first point and introduction as well, because I know you said you had a lot of people come and have exercised previously and then not
Mhm.
sure what to do in their pregnancy. And
Yeah.
I think there's lots of things, simple things that you can do, which we might cover later, but it's just moving your body. It's even like just going for a walk. But it, you should be getting your heart rate up as well if you can,
Yeah.
that kind of exercise. And it just makes you feel better. I think that it's like before pregnancy when you'd exercise, it's time for yourself. It's making you feel getting all those good endorphins. It's also about maintaining your fitness as well. So if you're someone who has exercised before, if you exercise during a pregnancy, then you can maintain your fitness going outside like postpartum and then getting back into your fitness quicker. Also
Yeah.
helps your recovery postpartum as well, quicker. It also helps with as your body changes shape. Um, we know that I'm actually 34 weeks pregnant now. We get a bigger tummy, but our boobs always get bigger and our bum gets bigger as well. So it's also making sure that, so when your boobs get bigger, for example, your shoulders might come in. So having those stretches or those back strengthening exercises to keep your posture.
Mm.
And also so you don't get things like lower back pain, upper back pain. It also means that you can once you've had the baby as well, which we might talk about a bit later, is you're then strong as well for the baby. I have a 2.5 year old. It means I don't carry him around everywhere, but it means I can pick him up to make sure he's safe as well. Like
Yeah.
I'm able to do that. Um, and there's also studies to say that um, it helps with your baby as well. So they think that exercise might be able to help the placenta live more oxygen and nutrients to the baby as
Oh,
well.
wow. That's interesting.
Yeah, and also studies have said that there's a higher chance of vaginal delivery and also lower chance of you gaining excess weight during your pregnancy. Yeah,
Wow.
which has a few benefits. I know people like to look good. So once you come back out, it's easier then to get back to a new version of you if that's what you want,
Yes,
but
that's
also for
brilliant.
health reasons as well.
Yeah. Oh, wow.
So they're just a few because there's lots of other things that are helpful as well, but they're
Yeah.
just a few.
Brilliant. I mean, I'm all about the kind of the evidence-based stuff. And so hearing that things like, gets more nutrients to the baby, to the placenta, to the baby, higher chance of having a straightforward delivery. Yeah,
Hmm.
it's brilliant because that's what a lot of us are looking for, isn't it? When we're, when we're
Yeah,
pregnant and birthing our babies. So, oh wow, it's
yeah.
brilliant. So we also hear a lot of kind of we hear a lot of stuff around exercise during pregnancy. We have a lot of people kind of telling us, oh, you shouldn't be doing that. Oh, you shouldn't be
Hmm.
doing that. Why aren't you
Yeah.
doing that? And don't do this and don't. And so, yeah. What have you heard about in terms of the common myths or misconceptions about exercise in pregnancy? Yeah,
Well,
tell us a bit about
I think the biggest one at the moment, I don't know if you've seen on social media or in the news, is that there's been a big study done about how much weight you can lift. So I think before, and even like now, some of your listeners may resonate with this, is that if you're pregnant, um, every like you try and lift something heavy, and people, oh, don't do that, sit down, is that kind of thing. And
that.
actually, so there's two sides to this. Actually, you can, if you do lift heavy, you can actually keep lifting heavy, is what they've said. That's what the research says. But on the other side, I'd say is just make sure that you're safe with your lifting. So if you don't lift heavy all the time, I wouldn't then go out and about in your day to day and lift something really heavy. Yeah. But if you do lift heavy, you can keep lifting heavy if you want to.
Yeah, that makes sense, doesn't it?
Yeah.
Mm.
So, but I think for me that day to day thing has been really useful because I do pick Harry up, who's my 2.5-year-old, and I know that I'm able to lift a table safely if I need to move it or something.
Mm.
Whereas in my first pregnancy, it's almost, oh, can't lift that, it's too heavy. Yeah. Whereas the research doesn't say that anymore.
Yeah, good. I'm glad the researchers kind of caught up almost.
Yeah, I
It's
know.
like, come on, yeah. I remember I had a client say to me the other day that her mother-in-law was saying that she couldn't stretch to, to get
I've
something
heard
from a
that one
high
as
shelf.
well. Yeah. So in my first pregnancy, I was doing a lot of dance classes, aerobic classes, and one of the ladies who came to me she must have been in her 60s, and she said when she was had a baby, she reached up and then it made complications with the baby or something. So I think it's not true. It's not true.
No,
I think there's like you have to be safe with the certain movements that you do, but
yeah.
yeah,
And it's all kind of reminding us yet again to look at the evidence and
yeah,
make decisions on how you live and what you do during pregnancy based on the evidence and not
yeah,
on just something that someone said, oh, when in my day this this is
yeah,
what we were told. And like, well, in your day, they didn't have the science and didn't have do the studies around why and what we should, be doing for that's best for us and our babies. So yeah, always, if you're watching this, please, look at the evidence and look at the research. And if you're struggling to find that, just touch base with Becca or touch base with me, and we can point you in the right direction. Definitely.
yeah. And the
Um,
other thing as well is to make sure you contact your GP or your midwife if you are concerned as
yeah,
well, because
totally.
you need to make sure that you're safe to exercise before you exercise. But most people, if you're a healthy pregnant lady, most people are fine to exercise
Yeah, I think
and they'll
that
probably
general.
recommend it.
Yeah, and I think that general rule about the fact that, if you were doing it before, then you can probably carry on doing
Yeah,
it.
yeah,
Yeah, and don't start something new during pregnancy, or, new exercise fitness regime. Whereas, like you said, with the weights, don't go lifting
well,
loads heavier.
yeah,
Yeah.
yeah, it depends
Mm.
because if you're someone who hasn't lifted weights before and you want to in your pregnancy,
Mm.
then it may be that you just have like tin of beans or 1 kilogram dumbbells or
Yeah,
something.
yeah.
Yeah.
Start light.
Um, or you someone might want to try like pregnancy yoga and they've never done yoga before. But it's knowing that you're at the beginner stage
Okay.
when you're doing it, and and yeah, and just being safe with it and doing it with someone who knows what they're doing.
Yeah. Okay, so how can you tell like the difference between like what's normal discomfort maybe during exercise and or a sign that you should be stopping and getting that advice and
Mhm.
talking to someone. So where's the yeah,
Yeah, it's a
go on.
great question because now I'm thinking of it more as someone who's a beginner. So if you already exercise, you probably know the difference between the discomfort when you exercise and when you should stop exercising. If you're a beginner and you've never exercised and you suddenly want to do some exercise, I'd always say if you're concerned, stop and go and speak to a professional.
Mm.
But you'll probably know because it'll be things like chest pain, it'll be things like bleeding, um, like if once you've stopped exercising, you've got a pain for a long period of time, over days, that kind of thing. And it may be that you don't need to stop exercising. It may be that you need to do something different or less intense, or maybe you need to have more rest days in between your exercise,
Mm.
something like that.
Yeah, that's really good advice actually.
Yeah,
Yeah.
but I think normally like common sense tells you. But if you're concerned, it also may be that you need to go and speak to oh, do you know what? I've got baby brain. Speak
Midwife.
midwife. No, it'll come to me. Like a
Your toe
not a chiropractor, but a
osteopath?
physio,
Physio.
a physio. Yeah, and they have like good, NHS physios and stuff that you can go and see. But it may
Yeah,
be that is what you need to do. But it
yeah.
definitely, if you're concerned, I'd always say it doesn't matter how big or small it is, go and speak to
Mm,
someone.
yeah.
It's better to do that than not.
Yeah, and certainly going off on a tangent a little bit, some women do get quite a lot of, like pelvic girdle pain or symphysis
Yeah.
pubis discomfort, whichever way, there's a few different names for it. And definitely go and ask for help with
Hmm.
it because, I had it during both of my pregnancies. I don't know if you've had it at all, but I had it during both of mine and from quite early on. And then my second time round, I went and got support from a physio, from a very good physio actually at my local hospital. And it was so much better because of it. We worked out between us what was best for me in terms of feeling of that discomfort. Because those of you who don't know, there's hormones that kind of hit your system during pregnancy that actually a hormone called relaxin that
Hmm.
helps all your kind of your ligaments and whatever you kind of relax does what it says on the tin, helps everything to relax. So it helps your baby to move through your pelvis when it comes to labor and birth. But for some women, that can hit you really early on during pregnancy, and you can be quite sensitive to it, and it can be quite painful. Some women even end up in crutches and in wheelchairs. A few do, not many, but a few. So it can be quite debilitating during pregnancy. So please, if you start having some pain around your pelvis, at the front of your pelvis, around the back of your pelvis, and then definitely see your GP, see your midwife, and get some support for it. 20 years ago, there wasn't a lot of support for it because people didn't really know much about it, and medical professionals didn't know much about it and weren't referring women. But I know that it's better now, and
I was
people,
loads better, yeah.
yeah, and they are recognizing it now and going, yes, come on, let's you can definitely do something about it to make you feel better and be in less discomfort, that's for sure. So
Yeah,
yeah.
and if you don't do something about it, it can lead to like more pain after you've had the baby as
Yeah.
well. So it doesn't just kind of like go away, some of these things.
Yeah, yeah,
And I think sometimes we're taught as women to just kind of like get on with it.
yeah.
But
Oh,
everyone's seen those videos on social media where the man's got the period pains on and he's literally crippled, and then the women's like, "Oh, this is nothing. Mine's are way worse than this." I think it's that kind of thing where you just
yeah,
go, "Oh, it's part of being pregnant," and actually there are some things that you can do about it.
yeah, totally. Please, please. Yeah, I think a lot of us women we just don't realize we can get help and we can get support either.
Hmm.
So so this next question we might have answered a bit already, but you know, if you are someone who is very or was very active before becoming pregnant,
Hmm.
um, Oh, sorry, no. What I mean, it wasn't very active. You have kind of answered this already. So, if they weren't very active before pregnancy, is it safe to start exercising during pregnancy, and where should they begin? Actually, you've kind of answered that already, haven't you?
Yeah, I've got a few other
Yeah,
things. I
go
think
for it.
that I think sometimes, and I find this with people who aren't pregnant as well, uh, and it's that you don't like when you talk about exercise, it doesn't have to be killing you off. So
Yeah.
if you want to go for a swim, you want to go for a walk, if you
Mm.
want to do something like that, that is perfectly fine.
Yeah.
And as long as you're getting your heart rate up, then it's going to help. And they recommend 150 minutes a week. So if you just do that in 30-minute blocks, it's quite easy to get in.
Yeah.
Um, and the other thing as well that I was thinking when it comes to this question is that think about what you want the exercise for. So if you, and there might be a couple of reasons, but it will determine whether you go to maybe want to go to a class. You might want to do pregnancy yoga. You might want to do, or you might want to go to one or exercise by yourself at home, whatever it is. Think about why you want the exercise
Yeah.
and do something that you like doing. Like pregnancy can be hard,
Yeah.
can't it? So you don't
Yeah.
want to, do
Yeah.
something. And I probably wouldn't also just decide that you're going to start running or something because I think and when you do strength training, you can start really from the beginning of like using you can use no weights if you want to and just use body
Mm.
weight.
Yeah.
And it's just like sitting up and down off a chair. So it's like stuff you probably do anyway. It doesn't have to be something really intense. Whereas when you start running, it can be a bit more intense on your body, especially in the first trimester when you feel sick.
Yeah.
So that's kind of my opinion, I suppose, on if you were going to start
Yeah.
exercising.
Totally. I totally agree with that. Always do the thing that you like doing. It's
Yeah.
really important during pregnancy to do that because, if you're doing something you're not enjoying, the hormones in your system are not the right hormones. And that's going to affect your baby as well. Your baby can feel stress and worry, which is another good reason for doing exercise because it will get, those good feel good hormones, the endorphins, the oxytocin, when they're in your system it means that the other stress hormones are not in your system. They kind of block it. It's amazing what your body can do. So it means it's a really good idea to be in a place where all the good hormones are flowing. So
Hmm.
always do the things that you like doing. So maybe if you don't like doing exercise, find something that kind of cheats your body into thinking it's
Yeah.
not doing it almost. I
Yeah.
I love some racket sports are really good fun actually. I've recently started a bit of pickleball, for example,
Oh
which is
yeah.
quite fun actually.
Yeah.
You really do have a giggle sometimes playing it. And I can imagine when you're pregnant, it's not, yeah, it's probably quite a bit of fun.
Yeah. So the things to think about as well is safety. So for
Yes.
example, if you are gonna don't play contact sports, for example,
Okay. Yeah.
and also things like cycling.
Yeah.
When you get into like your second and third trimester, think about is it safe for me to be on the road? And your balance goes, so think about that.
Yeah.
And also car fumes as well. So when you're choosing your exercises, just think, is this safe?
Yeah.
Yeah. So maybe not like rock climbing,
Yeah.
you know, those kind of things.
Yeah. 'Cause I'm thinking some women will think of, racket sports and think, well, what about the ball? What if the ball hits my belly? And actually, if you don't feel safe doing that and think,
Oh
actually, I don't
yeah.
want the ball hitting my
Yeah.
belly, then just don't do it.
Yeah. Yeah.
Yeah, because there is a slight chance that that could happen. But
Mm-hmm.
remember, your baby is very well cushioned in there.
Mm-hmm.
But if you don't feel right doing it, that's really, really important too. Yeah.
Oh no, it is 100%. Yeah.
Mm, yeah. Brilliant. Okay, what other questions have I got? Let's have a look. Um, what about yeah, this is a good one actually. What can women do during pregnancy to help prepare their bodies for labor, birth, and postnatal or postpartum recovery afterwards? So there's some top tips that you can maybe give our
Yeah.
watchers.
So I think that just generally being fit and active helps with the
Yeah,
change of shape and also the weight gain. And also being aware of things like, so your balance goes as you get more pregnant. So it may be that you do things like lunges to keep helping your balance,
Yeah.
that kind of thing. But just like walking helps. So if you someone who
Huge.
likes walking, that helps. You get outside, keep moving, and also helps the baby as well.
Mm.
Strength training. So as I said before, it helps as your body changes shape, but it also helps with things like carrying and lifting and looking after a newborn. Because I don't know, some of your listeners may have never had kids. And when you're trying to hold a baby for hours on end, your arms really hurt.
Yeah.
You're like stuck in the same position. We call it
Yeah.
the or the nap trap.
Yes.
When you're like the baby's asleep and you're like, I'm not moving because the baby's asleep, and you're just stuck in one position. Some of your listeners may also be on their second baby breastfeeding while walking, just kind of like getting it in when they can, kind of, in the queue
Yeah.
to somewhere. So
Yeah.
it just helps with like being strong. And that can just
Mm.
literally be like squats and, like all those everyday kind of movements
Mm.
to make sure that you're in the right position in labor as well. That you can get in the right, so you're mobile enough to
Yeah.
be in the right position for
Yeah.
labor. The midwife probably has already gone on about this, but pelvic floor. So pelvic floor really helps with, and there was a study that said that um, there's fewer cases of active pushing in the second stage of labor lasting longer than 60 minutes when you have a strong pelvic floor.
There you go.
So, um, and the last one's core strength. And I think sometimes people think core strength is doing sit ups, but actually, as you get further into your pregnancy, you won't want to do sit ups and you shouldn't do sit ups. But it's
Mm.
just doing things like one of the exercises you can do is bird dog when you're on all fours, one arm out, opposite leg out and back in, then the
Yeah.
other side. And it just reduces back pain, improves your movement, supports recovery after birth. If you have a strong core after you've had the baby, you get back into life quicker as
Yeah.
well.
Yeah. Definitely. Yeah. I remember just picking up on your kind of holding babies and as they get bigger as
Mm-hmm.
well. Just, yeah, your arms do really ache. So any kind of weight training you can do to get those muscles in your upper body a bit stronger will definitely be a benefit. Yeah. And I
Yeah,
want
and
to,
it seems to
yeah,
be like up here.
yeah,
It seems to be like the pain comes around here,
shoulders
around
as
like your
well.
neck and your upper shoulders
Yeah.
when you're carrying around a baby for so long.
Yeah.
So having a strong upper body is
Mm.
really useful.
And those babies ladies will want to be on you when they are born. They've been used to being
Yeah.
inside you for like 9 or 10 months. And when they come out, they'll want to be clung to you. And that's absolutely fine. But just be warned, it's not, yes,
Hmm.
your baby won't be in you anymore, but it definitely will be with you and on you. Be
And I
prepared
don't
for
know
that.
if it's a boy thing, but my 2.5-year-old still wants to be all over me.
Yeah. And some
So
babies are more than others, but yeah, most of them still want to be. You are their safety blanket, you know.
yeah.
You are the thing that is keeping them alive, and they know that. So they want you to be within, a very short distance at most times. So yeah, that's normal.
The other thing
Um,
as well that's just come to me is that if you're strong in your lower body, it's things like getting off the chair. And I know
oh,
it sounds silly because sometimes I see these videos on social media where, the man's got the melon or something attached to him like that.
yeah,
And
pretending to be pregnant. Yeah.
but as a pregnant lady, it's not the weight you have on the tummy. It's not like how awkward it is. As you
Mhm.
said earlier, it's like the relaxin and all those other hormones when you're trying to get off the chair to be able to.
Yeah.
It's those little things you don't think about until you are pregnant in the middle of it all. And actually having strong lower body and strong upper body and core is just really useful.
Yeah, definitely. Oh yeah, I remember it well getting up off the sofa.
Yeah.
Yeah, it's the little things, isn't it? And I want to pick up on your positions for birth as well, because sometimes during labor, your body will just, and your baby does this to a large degree, your body will just tell you to change position and tell you to get into a different position, because sometimes your baby just needs to move through the pelvis, a slightly different angle. It gets maybe a little bit, not necessarily stuck, but just kind of trying to work its way through when you're having contractions during labor. And it will communicate with you, that baby. And sometimes that communication um, will make you, and it's the hormones that does that, the hormones will go, move. Yeah.
Hmm.
So if you're sat down on the bed, or if you're walking around maybe the room having contractions, all of a sudden you'll think, actually, I want to get down on all fours, or actually, I don't want to be, sat down anymore. I need to be stood up, and just listen to that. It's really important. We listen to that gut feeling. But, being strong and being fit and strong will make it easier for you to get into some different positions if that's what your body and your baby needs. So, yeah,
Hmm.
I love that too. Um, have you got any, just to finish off, any kind of exercises, movements, physical prep kind of strategies that can help women kind of feel more comfortable, especially in late pregnancy, actually, because we can get pretty uncomfortable during late pregnancy, but anything that might help us, support us potentially during labour and birth as well.
I think the biggest thing, and I don't know whether you recommend this to your clients that you work with, is a yoga ball. You know, like these
Yeah,
big
I
balls that you
do.
sit on.
Mm.
Because at the moment, so I'm 34 weeks, and I find that standing up for long periods of time causes me a lot of pain. And even if I just sit on that ball, even just sitting on it helps. But you can do like hip circles or figures of eight, just rocking. You can do pelvic tilts on there. You can do your pelvic floor muscle exercises as well. I
Mm.
also find on the same ball, you can, you might suggest it for labor as well, but bringing like your upper body onto it and your knees on the floor, just kind of rocking back and forwards,
Yeah.
those kind of things, just like free up your hips,
Mm.
really helps.
Yeah, it puts your pelvis in the perfect position as well in terms of helping get your baby in a good position. Your pelvis tilted forward, you being upright as well. All of that will help massively. And yes, my little top tip for the birth ball when you're kind of hugging it or lying over it is to
Mm.
put like a towel or a blanket or a scarf or something over it when you're over it like that.
Oh yeah.
So it means that you can kind of rest your head and rest your cheek on it, and it's not such a kind of a sticky plastic thing that you're, you've got a nice comfy blanket or something. Yeah, it's much nicer, and it also kind of soaks up your dribble as well
I
when
had
you're
to
relaxing on it.
my dad pumped mine up and I had to get my smaller ball out for my son. So he has the purple small one and I have the big blue one. And so we both have our own balls
Love
to
that. I love that. It's a great idea. Yeah, because I often hear, especially from second time mums, that their toddler loves the ball and I
oh
have
they
to
do,
keep it away from
yeah.
them, or yeah,
Yeah, he
but
climbs all
yeah,
over it, jumps
embrace
on
it.
it. Yeah.
Yeah. Yeah, if you haven't got a yoga ball, birth ball, gym ball, whatever you want to call it yet, then please do get one. In terms of sizes, you can find out on the internet kind of what size is best for you, but a lot of the time when you go and buy the ball, it will tell you, depending on what height you are, what size you should get and what have you. But they are brilliant. And as Becca says, just sitting on them is just so relieving. The kind of relieves all the heaviness and pressure that you feel late on in pregnancy, doesn't it? It's just
Yeah.
so, so good. If you haven't got one yet, please get one. Or if it's out but not pumped up yet and you're waiting for someone to pump it up, then get them to pump it up or just pump it up yourself, please. No
Yeah,
more
it's essential.
excuses.
Essential.
It's definitely essential. Brilliant. Is there anything else you want to kind of talk about? Anything else you want to touch on that we haven't touched on yet?
I think so. I think all I want to say is that don't feel like the pressure of exercise. We've said
Mm.
before, do something that you enjoy, make sure that, and if you stop enjoying it as well, do something else. Like if you feel like your body needs something else, give it something else.
Yeah.
Um, and don't force yourself into stuff that you don't like or feel like you should have to, for example, keep running because you were running before. If it doesn't feel good for you, try something else.
Mm. That's brilliant advice. Thank you so much. Great
Hmm.
advice for everyone. I hope they're all listening to you. If if they want some more help and some more maybe coaching from you, how can they find you?
So I'll add so I'm on Instagram, and I'm also, you can email me as well if you want to. I'll give you my details to put in it'll go on
Yeah, in
YouTube,
the
right? So the
yeah,
thing on the comments. I am going on maternity leave at the end of June, but I'll be back in January. So it depends when people are listening to this. But I'm more than happy to help. So any questions that you have, you can just message me and I'll answer them.
brilliant. That is so useful. Thank you so much, Becca. It's
No,
been a
thank
lovely
you.
chat. Yeah, really lovely chat. And I will speak to you again soon.
Thank you.
Thanks.
Bye.
Bye.